Ghost, we make him fly like a ghost. If he want talking the game, the heater gon' turn into toast. If he pull out and we spliffed him, he was just doing a distance. Promise we ain't gon' miss him. His soul gon' fly when we lift him. Bye, good riddance. Why is this hurting her feelings? To the top on a mission. I got a shot, take it with precision. You ain't up if you ain't down to get it. Fuck your vibe if you ain't vibing with us. No, no, no. Bye, bye, bye. Clock him out. He ain't gon' talk when the Glock is off. You ain't gon' talk when the Glock is off. Headshot, knock him out. Ah, get him, bye.
So hello everyone. Oh my God, of course my dog, she waits right for me to say hello everyone.
Of course, of course.
Sorry, it's my dog. I'm telling you, my dog, my cat, they disrespectful. They just
The
disrespectful.
dog, the cat, the son, the husband, you know.
Right? All of them, all of them.
It's like never ending.
Sheesh. Okay, so let's say hello to everybody very quickly. Oh my God, my phone keeps jumping. Okay. Hi, Vera. Allegedly. Hey, Miranda. Hello. Kirsten. Oh, sorry, forgot. Kirsten. Hello. Azzy. Hey, Mama. Who else? I said I had to feel the love. Shay. Deborah Young. Hello. Hi, interesting discussion tonight. My brother lost 2 friends to AIDS. I'm sorry to hear that, Deborah Young. I also lost my sister, so I understand. Nezzy Pie, hey mama. Let's see. JayJay, hey JayJay. JFid, hey mama. I'm just glad to have a video not about the dang drama, but about something I'm interested. Thanks, Cindy and JayJay. I truly appreciate you. Thank you for being here, JFid. Adele,
Yes,
hey mama. Hey, just chat. How are you? Let's make sure, because BB's, hey sweetie boy. Okay, I think that's it. Welsh Rose, hello sweetie pie. Yes, thank you, Deborah Young, and I'm sorry to the 2 people your brother lost as well. Thank you for the love. Yes, trigger warning. This whole live is trigger, like all my lives are damn trigger warning. Damn it, God damn it.
Sensitive content.
Yes, we will be talking about HIV, AIDS, maybe hepatitis C, substance abuse may be in there because sometimes they're intertwined. So the entire live is going to be trigger warning. Before we begin, disclaimers, always got to make the damn disclaimers. I know that there is a lot of stuff going around on YouTube. I have decided I am disengaging from all of it. I want nothing to do with any parts of it. I would just like people to leave me out of it, please. If I have to speak, I can speak for myself. So I would really genuinely and sincerely appreciate if I could just be left out of all of it. I also want to explain something. Some people may not have Twitter, may not know. Friday, I posted on Twitter my toxicology reports, and I did feel conflicted about doing that because I felt like in me doing that, I may have inadvertently contributed to people now feeling that if any accusations are lobbied against them, that they have to take that route. Please, no one has to do that, okay? I did it because this is what I want to discuss on my channel. Recovery, addiction, all of these things. My reputation, I felt, was at stake. Not that if someone relapses, they should be looked at any less than anyone else. Everyone deserves respect and dignity, but these were lies that were said about me, okay? And I felt like the only way I could address it, because it was said on someone's channel and then it was said on someone else's channel, and I felt that I had to address it, and the only way I could address it is to show proof that I am, in fact, clean from all substances. As I said, please don't misunderstand anyone who is still in active addiction, who is still suffering with that, struggling with that. Please do not misunderstand me. I would never look down on anyone, demean anyone, but this is my reputation, okay? I am a substance abuse counselor. I am an HIV counselor. These accusations can have serious consequences for me with jobs, that I may be looking into. Every potential employer looks on social media nowadays. It is a part of everyday life. It is a part of employment. It is a part of all kinds of things. I did not want that said about me, so I chose to show proof. Okay. No one should ever have to show drug screenings on social media. And so if I did set a precedence with doing that, I am sorry. If anyone is disappointed that I did do that, that they felt like I shouldn't have done that, I didn't need to do that, I am sorry to you as well. But I did feel like I needed to do that for my own well-being. I have 5 sons. I know what it is to have people, when you first get clean, people don't believe you, people question you. You may be down and out, you may be struggling, and people wonder, is it for food? Does she really need that? Or did she fall back into her old habits? I've been dealing with that for a long time. I no longer had to deal with that because everyone in my life and real life knows who I am. I am not that kind of person. I'm very honest. Had I relapsed, I would have said it. But I am also not that kind of person. That's not how I deal with my issues. Please, again, I'm not trying to put down anyone else who is still actively using and struggling with that. That's just not how I deal with it. I've learned to cope, and this is why I'm here, to help others, to give them the tools to learn to live life. And coping to me was the key. Okay. So I just wanted to put that out there because I know some people have seen it on Twitter. Some people have questions, and the support that I have gotten is overwhelming. I am honored. I am humbled by all the support. So I wanted to say to everyone, I could never express in words how grateful I am for all the support that I've gotten. It means so much to me. I honestly, it means so much. So thank you all for all the support I've gotten. Everyone that's spoken up and against what was said about me, I can't thank you all enough. Okay, I don't expect people to go and speak on my behalf. That's not what I want. I just appreciate all the support, all the DMs, all the messages, all the tweets, everything, guys. I appreciate you all. So I just wanted to say that before we start. We're going to be doing kind of the same thing we did before, where JayJay asked me questions that she may have wanted to know, and maybe hopefully others have wanted to know. The first one was about substance abuse. I am not a doctor, okay? So anyone that has any medical questions, please see a doctor or a medical provider. I am just here to speak on what I have experience with, because as I said, my sister had HIV. My sister died of complications with HIV, with AIDS, because she wasn't adhering to her medication. Anyway, so I have personal experience with this and professional experience. I worked in harm reduction. I am an HIV counselor, peer educator, all of that good stuff. Okay, so JayJay is going to ask me some questions, and I will answer them to the best of my ability. If it is my opinion, I will state as my opinion. Okay. Hi, Froggy. Hi, Channelie Dish. Hey, Mama T. Sorry, I'm always doing that. 50 Shades of Beach. Hey, baby girl. Hi, everybody. Did I say hi to J Fit? I probably did. So everybody, hello, Patty Brunner, my girl. Hey, guys. I'm sorry. I do that to JayJay and I scare the hell out of her. I do like, hey. So I'm sorry, guys. And that's why last time when we did the live, I didn't do that because I didn't want to distract from the conversation. And, so I'm sorry to anybody I didn't say hi to last week. I did see you all. Hi, Dark Magician. See, I'm doing it again. Hi,
I'm gonna kick your butt.
I know, sorry. Okay, love you all. Okay, so let's begin. I'm gonna try to just, if I put your comment on the screen and I wave, I'm saying hello to you without distracting JayJay. Okay, love you all. Okay, all right, JayJay.
Okay, so first I want to say that if you guys happen to hear a tiny human voice in the background, I have my 1.5-year-old niece. She's a little cranky and watching Barney. So if you happen to hear Barney, I didn't even know Barney was still a thing. Did you guys know Barney was a thing?
No.
Barney was a thing when my kids were little, but it's a thing because she's
mine
loving
too.
it.
I didn't even know Barney. I didn't even know it was still on. That's true. I didn't know. Oh no.
Oh, she sees you on the computer. She's waving to you.
Hey, hey, baby
funny, and she's
Oh my gosh,
blowing
she's so
kisses.
cute. Oh,
She's
mwah,
the
mwah.
sweetest little thing.
Oh my God, I want her so
Okay.
badly. Okay.
All right. So the questions that I have, again, some I probably knew a little more about this than I even did addiction, which is odd. You would think I would know more about addiction because it's spoken about more.
Right.
But I still wrote down some questions that I thought of that would be good to know. And I don't know the answers to all of these. So I'm hoping you can help me
Okay.
and help the audience.
Okay. Before we
All
start,
right.
hi Jim Jules. I just
Okay.
want to read her comment. She said, Cindy, don't beat yourself up over what precedent you may have set for others. It just shows how open and honest you are by providing info from the raw source. Thank you, Jim Jules. And love you, girl. Thank you so much. I appreciate that. Okay. So go ahead.
Okay. So my first question is, you're a certified HIV/AIDS counselor. What does this job entail?
Okay. So, oh God, guys, listen, I kept turning off my camera because I hate when I put oh my God, highlight on my nose. It bothers me so much. So now I'm self-conscious. Before it didn't bother me, but now all this bull crap, I'm worried like to just, first of all, it reminds me of Katie Joy. Second of all, I don't want anybody saying some crap. It's the makeup, guys. It's annoying my nose. Anyway, okay. So being an HIV counselor entails many things, right? Because when I went to school, it was substance abuse, sorry, excuse me, HIV and hepatitis C, because those kind of intertwine with each other. Many people who have,
Yeah.
okay, not many, some people who have HIV contracted it through substance abuse, and even if they didn't contract it from intravenous drug use, they contracted it from the risky behaviors of being an addict, because they may be prostituted, had unprotected sex. So they're all kind of intertwined. So when I went to school, we had to learn about all of them, about how substance abuse interacts with HIV, and hepatitis C and HIV were a big thing. So many people were being dual diagnosed. And so it entails educating people about HIV, teaching people about the importance of adhering to your medication. Adhering to your medication means taking your medication as prescribed, not missing a dose. And if you do miss a dose, to take it immediately after, because HIV medications, after a certain amount of time, there is a threshold where, like, let's say 24 hours. Within that 24 hours, if you don't take your medication and you miss it, after the 24-hour mark, the effectiveness of the medication goes below a threshold, which allows you then to become oh my God, where the medication will no longer work, resistant. Sorry, I couldn't remember the damn word. Where you can become resistant to medications, and that is when you can become very sick. And so anyway, I'll go into that later, because there's a whole different, there's classes of medications and all this other stuff. So it's about teaching harm reduction, teaching how to lessen the risks, teaching safe sex, um, trying to reduce the stigmas, and teaching people of all the safe practices and what having HIV actually means, that it's not a death sentence anymore as long as you adhere to your medication and all these things. So it's so much involved, but yeah, that's basically in a nutshell what it entails.
Okay. Okay.
Yes, and blood transfusions before 1975 though. Blood transfusions before then, yes, people contracted hepatitis C and HIV. Afterwards, it became safer. They were testing the blood to make sure there were no HIV in it. So yes, you're right, Adele. Blood transfusions also right before 1975. So I'm sorry, go ahead, JayJay.
Okay. The next question I have is, what is the big difference between HIV and AIDS?
Okay, so HIV is, sorry. Hi, Dina. Thank you for being here. The difference really is, uh, AIDS is when you are below a certain amount of T cells. T cells are your cells that help you fight against everything in your body. They're the fighter cells. Your T cells are your fighter cells. Your viral load just means how much virus is in your blood, in your body. HIV and AIDS, there can be different numbers of the virus in different organs, in your blood, all of that. So at one point, it was only thought to count the viral load in your blood, but your liver can contain more or less virus than your kidneys or something like that. So your viral load, they do viral load tests. They also do CD4, which is your T cells, test to see how many fighter cells or T cells you have to fight the virus in your body. So as long as your CD4, which is your T cell count, stays above 200, 300, you're still categorized as having HIV. Anyone who goes below 300 to 200 is now categorized as having AIDS, because your body really cannot, the virus is replicating way too fast for your CD4 cells or your T cells to combat it and to try to keep it under control. So, I mean, I can go into what HIV means, AIDS, that's all really just like a lot of, technical stuff. But basically, that's what it means. It just means the difference when your T cells go below a certain number, you are susceptible to kidney failure, liver failure, your organs shutting down, and the virus is just replicating at such a quick rate that you die. People usually have died because of the complications of AIDS, which is liver failure, kidney failure, all pneumonia, all these things, because your body can't fight what normally you would be able to combat. So I hope that makes sense.
Yeah, it does. What is the
1985?
average
Thank
time?
you. 1985. Thank you. Sorry. Okay. Sorry. Go ahead.
What is the average time that someone begins to feel sick from the time that they are, or from the time that they have contracted HIV? Does it depend on the person?
It does. Some people can be asymptomatic, which means they have no symptoms, and then some people will get like flu-like symptoms. So it all depends, and that's why we teach people the risk factors. If you fall into a certain risk group, you should get tested every 6 months. There's also people that may be in a relationship with someone that is HIV positive. For people that are in a monogamous sexual relationship with people that are HIV positive, you want to get tested every 3 months. And it all depends as well. So it's all depends on the person, the state of their body. It's very different. Some people may have symptoms right away. Some people may not have symptoms for years. Some people may never know until they're tested. So that you can't gauge someone having HIV by that, because that can be very misleading. So
Okay. And how, I mean, I know some basic ways that HIV is transmitted, but can you go over those ways again? Because this is something that was discussed. I graduated high school in the 90s, and it was something that was discussed and you heard a lot about in the the 80s, 90s, that I can remember. And I know that it has gone back even as far as the 60s in the United States.
Right.
But what are some ways that people can contract HIV?
Okay. So it also, before I answer this question, it also depends on if a person with HIV is adhering to their medication and if they're undetectable. When you become undetectable, what that means is that the amount of virus or the viral load in your body is at such a low number that the sensitivity of the test cannot detect that number of virus in your body, which means that it's really, really low. So the goal now for people with HIV is to get them to an undetectable state. a state where the virus is not replicating at a rate to do damage to their body, so that it's manageable for the rest of their lives, essentially, as long as they continue to adhere to their medication and don't become resistant to their medication. So it all depends on someone who is undetectable. It is now believed that they can no longer transmit HIV sexually, but it can be transmitted through blood. Okay, understand? So
Okay.
as let's say, trigger warning, guys, we're going to be talking about sexual natures and all of that, sensitive topics. Okay, let's say, but that does change if there is any blood in the sexual act. If any
Okay.
blood is mixed in, because let's say that if I'm having anal sex and one of my membranes in my anus are ruptured and there's blood there, then the ability to contract HIV, of course, is there. Whereas if there is no blood, it's almost impossible now, according to studies, to pass HIV to someone. That is only someone who is undetectable. Again, so you can get it through sex. For someone that isn't undetectable, you can get it through sex. You can get it through blood. So sharing needles, even razors, toothbrushes, any place where blood can be transferred from one person to the next. Now with HIV, where it varies from hepatitis C, is HIV, once hits the air, it is believed for the virus to die. Where hepatitis C, the virus can live outside of the body on a toothbrush for a few days. So that's the difference between hepatitis C and HIV. It is believed that once HIV hits the air, as you know, or is exposed, the ability to contract it is not there. Where hepatitis C, you can still contract it for a few days after. So
Oh.
yeah.
Oh, I didn't realize that. Okay.
Mm-hmm. Yeah.
And are people of color more likely infected with HIV or hepatitis? And if so, why?
That's a loaded question. It was back in the days, the highest number was among homosexuals, and I'm not being disrespectful. That's just among gay men. That was the highest number back many years ago. Now it's younger people. The ages between like 24, young kids are getting it because of unsafe sex practices and all this stuff, and with drugs and all of that. So it is because they had believe that because of the poverty and all this stuff, but I don't think that it's it all depends on who you speak to, the census, that people do, but it all depends. But back in the days, yes, that's what it was believed, that it was among gay men and minorities. But AIDS and HIV affects all walks of life, all demographics. So yes.
Okay. And okay, so a few of my questions are going to involve some public people that have come out publicly with having AIDS throughout the years. So I'm going to kind of include them in some of my questions.
Okay, I just want to answer. I'm sorry, JayJay. So
it's
sorry.
okay.
Adele had a question. She said, "What about new moms first breastfeeding? Nipples bleed, can give it to babies." Again, that all depends on where the mother is. If she is on medication, mothers can breastfeed if they're undetectable. When I was working in a place, it usually moms were advised against breastfeeding. But it's again, it is believed that as long as you are undetectable, you really can't transmit it through breastfeeding. But if there's blood involved, yes. So that's why doctors tell moms that have HIV that they really try to discourage against breastfeeding, just in case. You know what I mean? Just to avoid anything like that happening. Let's say it's weird because, okay, I'm gonna tell a quick story. There was a mom that had HIV and was pregnant, right? And was on antiretroviral medications, right? Medications to help her keep her HIV in check. And when she gave birth, the baby was negative, and they tested the baby every so often for the first 2 years, and the baby remained negative. So they really try to discourage against breastfeeding because you don't want to take a chance in doing that. And I know it's a sensitive subject because mothers want to breastfeed, but mothers who have that, and as I've said, a lot of people were dual diagnosed, had hepatitis C and HIV. But now, since that treatment for hepatitis C, which is essentially a cure, the first medication was called Harvoni, which really was curing people of hepatitis C, because that's what happened when people, a lot of people that were dual diagnosed, like my sister. Okay, my sister was dual diagnosed. My sister had HIV and hepatitis C, and what happened was that the hepatitis C accelerated her kidneys and her liver deteriorating, because her liver, hepatitis is, hepa is liver, titus is inflammation or swelling and redness. So it's an inflammation of the liver. Your liver is not functioning properly. And what happens with hepatitis is that our livers are the only organ, besides our skin, of course, that can regenerate. So they can take a piece of a liver and transplant it to someone, and after time, the liver will regenerate. What happens when you have hepatitis is that your liver begins to harden, right? It begins to harden, which is called fibrosis, is the hardening of your liver tissue. And then it goes to cirrhosis, which is a scarring of your liver, which then leads to liver cancer, because our livers are very porous, but when they become hardened and then scarred, it's not able to filter, it's not able to function, which then leads to liver failure, liver cancer. And so that is what essentially killed my sister, was being dual diagnosed. So when people are dual diagnosed, what they realized is to get the hepatitis C cured, because once they get that cured, the damage to your liver stops, and then you can just work on controlling the HIV, which with medication and adhering, you can live a normal life. So the focus on a lot of doctors was to take care of the hepatitis C. The treatment is very expensive, like $100,000, but thank God with insurance, 100% of the people that were given the treatment, the Harvoni, have been cured of hepatitis C. So, sorry, I went somewhere else, but yeah. Sorry. Oh, go ahead, JayJay. Ask me your question. I'm sorry about that.
Okay. Okay. So many of us remember when Magic Johnson came out publicly as having contracted HIV. Okay. A lot of us remember. If you're
Yes.
like old like me, then you remember. So
yes.
What exactly had kept him alive? Is it, is the drug expensive that keeps a person alive that is diagnosed with HIV, or is it readily available to people regardless of socioeconomic status?
Oh, back in the days, it wasn't readily available, of course, because we had the drug trials, and we had, through trial and error, there were medications that actually didn't work. And of course, because Magic Johnson was rich, he was, and had the best doctors, of course, he had the ability to get to these medications that were far more expensive, because money wasn't an object for him. So I think with him being able to get these medications that are life-saving, this is why he's been one of those to be able to lead a normal life. Now, everyone basically has the ability to have those HIV medications, because there are so many programs that if you don't even have insurance, they will help you get insurance to get the medications needed. And there are so many medications because HIV is such a tricky drug. It affects your body at different stages. So that's why they have different classes of drugs. Um, and before, when you first started taking antiretroviral medications, you had to take a cocktail. It was called the cocktail because it was so many medications that you had to take, because they had one from each class, which is to combat each stage of where HIV would try to infect your body and infect the cell. They had one that tried to attack HIV before it went into the cell. And if that didn't work, there was another medication to catch it when it entered the cell. Then there was another medication to get it before it fused to your cell. Then there was another medication to get it as it left your cell. And before the RNA was turned to DNA, it's so many. But then they were able to combine medications to make it like 3 drugs and then 2 drugs. And there's, in some cases, some people that only have to take 1 drug. And so they've combined all these classes into one. And that's why it's so important to adhere to your medication. Because if you don't adhere to your medication and you become resistant, you're becoming resistant to whole classes of medications. And that's why it's so important, because all these medications are now combined into one. And if you don't take your medications right, you may become resistant to all the medications on the market. And this is what's happened to some people. That's also a thing where, let's say I'm someone who, God forbid, had HIV and became resistant, right, to all these medications. And now I infect someone. They now are infected with a resistant strain of HIV. So now they are now resistant to all those medications that I am resistant to, because they've contracted the strain that I have. And this is why it's so complicated and so important to adhere to your medication. Stina has a question. She said, so they could probably pump and bottle feed the breast milk, but not feed straight from the breast. Yes, and some moms will pump the milk, so that there is no contact with skin to skin, no possibility of the babies that are teething to bite down on the breast, any blood being involved. Yes, there are still risk factors, but it's very, very, very minor. So yes, that is also a possibility, Stina.
Okay, so I remember the Ryan White story. For those of you that don't remember the Ryan White story, he was a 13-year-old from Indiana that had hemophilia, which is a genetic blood disorder in which a person's blood does not clot properly. Ryan White needed weekly blood transfusions, and during one of said blood transfusions, he received blood that was infected with HIV. He became known, and a movie made of his story when he fought the school system that would no longer allow him to attend public school due to his HIV diagnosis. While I realize we've come a long way in HIV testing and prevention, is there anything that one could do to ensure that the blood they are receiving in a transfusion is clean from the virus and or other disease?
Yes. So now any blood that is donated is put under rigorous testing. It is tested and tested to make sure that it is free of all these viruses. So yeah, it's basically impossible nowadays to contract HIV through any blood transfusions, because of how many people had contracted it before it was known that it could even be passed that way. That blood through blood transfusions was contaminated. So now that's impossible. It is rigorously tested, so to avoid
Okay.
that from happening again. Yeah.
Okay. And Miranda, I think it's just the Ryan White story, but I'm sure you can Google. It was a really good movie, and it's sad. He passed away in 1991 before there was the drugs that I guess were approved or that actually worked.
Right. Yes.
So yeah, so Ryan
And
did.
that
He
were
died.
readily available. It wasn't readily. Remember, there were so many trials. You know what I mean? There has to be all
Yeah.
these drug trials before they're FDA approved. So it took so long. And sadly, some people didn't live to see the strides in the medication and in the medical advances that we have now. Sadly,
Yeah, a
like,
lot
you
of
know,
people
yeah,
didn't. The 70s, 80s, and 90s were insane, especially the 70s and 80s with people dying. I mean, it was just everywhere. And I remember, sex education in school. It was, here and there about sexually transmitted disease, ones that are curable, but
yes,
HIV was a big thing. I mean, it was
yes.
talked about all the time.
And Vera
Okay.
had a question. I'm sorry, JayJay. Vera had a question. What is the
Uh-huh.
prevalence of HIV and AIDS now, since so much information is available? As you know, because of COVID, right? A lot of censuses have been halted and all this stuff. Uh, these, doctors and everything, it's kind of at a standstill. So the last known statistics we have are from 2019. So in 2019, 1.2 million people were living with HIV in the United States. And there were 34,800 new infections in the USA. 1 in 8 people living, oh my God, I'm sorry, my back is hurting, living with HIV in the US don't even know that they have it. That's the
Wow.
importance. And that is what we try to teach people, that getting tested is so important. Some people are so afraid, they're just like, I don't want to know, I don't want to know. But it's so important to know, because now you can live a regular life. You don't have to be on a cocktail of drugs anymore, with like 10, 12, 13 drugs. There's uh pills that are just 1 or 2 pills a day. It's so
Yeah.
advanced now. So it's so important to get tested, and it's better to know, because the earlier you know, the better you can be to make sure that you don't have a resistant strain. It's just so important to get tested. So,
Okay. Okay.
oh, one more
Okay.
thing, I'm sorry. So I think you had asked, it's prep, right? I'm sorry, you didn't ask, but there's also a thing called prep now. Prep is for people that may be at risk for contracting HIV. um So now people are, sorry, there's 1.1 million people that are eligible for PrEP. PrEP is, there's a pill called Truvada, and it was a pill that was one of the antiretroviral medications. And they found that this pill Truvada can actually be used as a PrEP medication to help people, to keep them from contracting HIV. So there's so many people that take this medication. Like I said earlier, if someone is in a relationship with someone that is HIV positive, the HIV negative person can take this pill at once a day, every day, and that will eliminate them, even the possibility of them contracting HIV. So there are PrEP available. If someone, God forbid, has unprotected sex with someone, you can go to your doctor and they will prescribe you PrEP medication for a certain amount of time to make sure that you don't contract HIV. There's so many amazing things that have been done um, to help combat HIV, so that no one has to lose their lives from it. So
Yeah. Yeah,
I'm sorry.
it's horrible. And what are the risk factors? Who is most at risk for HIV that should get tested frequently? Obviously, prostitution, sex work, we know
Yeah.
they should probably get tested often. But
People using
oh, right,
drugs
right. Okay,
are the,
intravenous.
yeah, are the most at risk, because blood to blood contact, and of course sex, for people that are not at, on medication, that don't even know you can get it, of course, through sex.
Uh-huh.
The statistics for people being non-existent for contracting HIV are people that are undetectable, people that are adhering to the medication. So people that are using drugs, people that are in promiscuous lifestyles, the risky behaviors, which are unprotected sex, using drugs, even if you don't have to use drugs intravenously, even people that may use them snorting them. Some people use straws, and you don't realize that when you put the straw in your nose, you puncture membranes in your nose. So if you share a straw with someone else, even sharing a straw, even sharing drug paraphernalia, that not needles, even sharing straws or anything else that you use in any of your mucous membranes can you can contract HIV through that way. So
Lord have mercy, that sounds horrible.
yeah.
Okay. Okay, let's see. Okay, so can a heterosexual couple safely have a child if either the man or the woman is infected with HIV?
Oh, that's a risky one. You can, but there's a lot of prep that has to be done with it. It's there's a lot that is involved. Because you can, but that's like playing Russian roulette. Not to sound insensitive. Not to sound
No,
insensitive.
it makes
I'm sorry.
sense. It makes
But
sense. I could see that.
There are large risk factors because sperm is involved. But again, if the person is undetectable, it can be done, but there has to be sperm washing and all. It's expensive because you have to see doctors and they have to help you, and there's all these medications you have to take and all these precautions you have to take and all these things, these procedures that have to be done. So it's very expensive.
Wait. Sperm, I'm stuck on sperm washing, and I'm also making a note because I need to look up how this is done. They wash the damn swimmers. How is that possible? Anyway, don't answer that.
Yeah, I'm not a
look it up.
doctor. Yeah, please, because I'm not a doctor. But that is what is done. There's so many procedures and so many things that have to be done for that to be done. For a couple that wants to have a baby, you know, with their partner, it's risky and it's costly to try to do it, and it's so
yeah, it's probably better off doing like an in vitro or something where they can make sure that
because there's always risks. There's always risks. You know what I mean?
Yeah. Okay, what do we got here? Okay, so once someone is diagnosed, how can they go about receiving counseling in, the state and the county or town that they live in? What can they do to look for resources?
Okay, so what is supposed to be done, right, is when someone gets tested, they're supposed to receive counseling right then. I'm going to tell a story of someone that I know, right? So someone that I know was decided because they were this is not me, guys. Before somebody runs with that rumor, okay? Don't I'm telling a story of a client. It's sad that I have to say that because this was a client that I had, okay? A client that I had was on a recovering drug addict and decided to go get tested for HIV, but wasn't participating in any risky behaviors anymore. So they just took it as a precaution. Let me go get tested. They went and they got tested, and it had been 3 months, and the doctor didn't call them to come into the office or anything. They even had forgotten that they had gotten tested. And sorry, guys. So they had even forgotten that they had taken the test, and they decided, let me go and see my doctor. So they went to see their doctor, and they were like, hey, I got tested 3 months ago and was wondering about my results. So they sit in the office, and the doctor says, oh yeah, you came back positive, and gives them the paper that they're positive. There was no counselor there. The person was allowed to leave, and before they got down to the lobby, the doctor was already calling security to have them back up. That's malpractice. You just told someone something that may cause them to want to self-harm themselves. You had no counselor readily available for them. You just told them casually, as if you told them that, you were just going to go have some pasta for lunch. And so when someone is coming to get tested, you want to have them have a small session of counseling, let them know the possibilities that are there. This is what we do. listen, there's a possibility that you can always come back positive. We ask them if they are currently still participating in risky behaviors. If so, what risky behaviors? We tell them the risks. We ask them, would they like to participate in harm reduction and needle exchange. If they say they're still using drugs, we try to enroll them in a harm reduction. If they're participating in risky sex behaviors, we try to get them condoms, all that stuff. And when they come back to get their results, there should be a counselor, somebody there, just in case, so that they can have that counseling, because you never know how somebody's going to react and respond. And of course, they are to be referred to counseling. You ask them, would they like to continue counseling, therapy? All of those services can be provided to them right there on the spot, because you never want somebody to leave and do something because you didn't provide them with resources that are essential to them, whether they are negative or positive, right? Somebody comes into your office and they want to get tested. That means in the back of their mind, they're wondering, did I catch it? Did I do something? Even if they don't want to relay to you what they've done, because some people have shame. They're embarrassed to say, yeah, I just did this. I just, had a one-night stand or whatever I just did. Some people are embarrassed and may not want to share that with you. So you have to always offer all these services, continue to offer it to them. You never know. You don't want anyone to leave and not have the resources to deal with whatever, and not be prepared to. You don't want someone to continue those risky behaviors. You want them to stop. You want to help them in the best way you can. So,
right. Yeah, that would be awful. I can't even imagine. Oh my gosh.
yeah.
Okay, so Chan Lee had a question and I wanted to get to.
I saw it.
Okay.
Will a woman
okay.
pass HIV to the baby while in the womb, or is it passed through birth? Do women with HIV require C-sections? So that's a great question. So as I said, if someone has HIV while they're pregnant, they put them on medications, and it is what has happened is they don't want the baby to pass through the birth canal, because that's when blood can be introduced to their mouth, which is really weird. You know what I mean? So they do try to do C-sections to lessen the risks of the baby contracting it while coming out of them, which is weird because you think the baby's in the body. How is the baby still not? It's complicated. I'm not a doctor, so again, I can't answer the ins and outs of how it doesn't happen, but I can just tell you what I know, that they do try to perform C-sections on the mom, because through the birth canal, that's what they're worried about. Any blood being introduced into the baby's mouth or any of the orifices, that's what they're worried about. So yeah.
Okay. All right. So the next one, some people may remember. I think this movie is actually a little bit newer. Okay, the movie Philadelphia, that starred Tom Hanks,
Yes.
is listed as a fictional story. However, it turned out that very little of the movie was fictional. It was mostly nonfiction.
Yes.
In court, it was proven that much of the movie was based upon an attorney from Boston, Massachusetts, named Jeffrey Francis Bauer. And I believe in Philadelphia, Tom Hanks was Andrew Beckett, Bennett or Beckett. I'm not sure, but it's been a while.
Yeah. JayJay, what the hell? What the hell, JayJay? She just kicked herself. I'm telling you, JayJay hangs out with me too long. I usually kick myself. She kicked herself. Sorry about that, guys. Okay. There you go, JayJay. What the hell, girl? The hell? Sorry. Wait. I'm sorry. I was all in your face. I was trying to turn my camera off because I don't want to traumatize y'all. JayJay, what the hell, girl? You taking my place with the kicking yourself? Okay, sorry.
Myself.
I'm smoking a cigarette, guys, so I'm just turning off my camera. Okay, but I'm here. Go ahead, JayJay.
I mean, would it really be a stream on your channel if I kicked myself at least once? So
nope. And trust me, before this is over, I will kick myself by accident. My phone will be disrespectful and kick my ass too. So
yeah, I can't take these disrespectful electronics. Okay, so I'm going to start this question over again.
Yes, please. Okay.
The movie Philadelphia is listed as a fictional story. However, it turned out that very little of the movie was fictional. In court, it was proven that much of the movie was based upon an attorney from Boston, Massachusetts, named Jeffrey Francis Bauer. And like I said, Tom Hanks was in it, and Tom Hanks played an Andrew, either Beckett or Bennett, one of those. But that was the character he played. They tried to say that the movie wasn't based off of him, but he won in court because just about every scene, well, the family won in court because just about every scene from the movie happened in his life. So, okay, so anyway, back to my question. Jeffrey was fired from a law firm after it was discovered that he was infected with AIDS and died in 1987.
Yes.
But he was fired. They let him go once it was revealed that he had lesions on his face, which were a sign of HIV.
Yes.
So he was fired from that. So I have a two-part question.
Sure.
Are many infected with HIV considered disabled, therefore qualifying for disability in healthcare? Or I should say, and for those that can work, do they face this type of discrimination that Jeffrey Francis Bauer faced?
Okay, so I know that people that have HIV and hepatitis C, they are eligible for disability, right? But it also depends as well. A lot of people are denied. So, okay, there's this in New York. I can only speak for New York, guys. I've only worked in New York. I only lived in New York. Can't speak for other states, okay? In New York, there is a program called HASA. It is through social services, through public assistance. Sorry, hold on. Sorry. Okay. So what it does, it's an all around financial program, which helps you with housing, which helps you with everything, right? HASA is its own little subdivision of social services of the HRA, where they help you. You get benefits for having HIV, you get special housing for having HIV. They encourage you to apply for SSI, for Social Security. A lot of people get denied if your HIV is being controlled by antiretroviral medications, which doesn't make sense to me, but that is how the system works. If you are if you are considered to have AIDS, you will get SSI automatically. But if your HIV is being controlled, it's a lot involved. Like if you're seeing a psych and all these other things, you may get it because you fit other criteria, but there are resources. You do get help with housing. They do pay your rent. So people with HIV in New York, there are a lot of help. You will never really have to be homeless because HASA will help you with housing. If you're a single person, you will get a studio. Depending on your family size, you will get an apartment fitting your family size or whatever. There are also there were a lot of people that had hepatitis C and HIV, as I said. Now with the cure rate almost at 100 for hepatitis C for people that get the treatment, anybody with Medicaid is really allowed the hepatitis C medication. There was somebody that I knew that worked his whole life and was never tested for hepatitis C because he didn't fit the demographic of a drug user or a promiscuous person. So they were never tested for hepatitis C, and they just happened to go to their doctor and they found out that they had hepatitis C and their viral load was in the millions, right? Ooh. So they needed that hepatitis C medication, which was Harvoni at that point. Now they have some other medications that are basically the same. The cure rate for hepatitis C is the same, but that is the medication I know of, Harvoni. Um, he, like I said, worked his whole life. His job, the insurance he had with his job would not pay for the medication. He needed the medication very badly. If not, he was going to have to get a liver transplant, which is, the waiting list for that is ridiculous. When my sister passed away, my sister was on a wait list for a liver, and she didn't live to see that day come. Anyway, so this man was devastated. Um, I've worked in this field. I know a doctor that is a specialist in HIV, hepatitis. She is one of the most amazing doctors here in New York. She she goes beyond for all of her patients. So I went to her and I told her his situation. I told her what was going on. She gave me some numbers and was like, have him call this person and I will get him to get that funding. He will get that medication. And I was like, are you serious, Laura? She was like, Cindy, have him call this person. I gave him the number. He called that person. He got the treatment. He is now cured. Um, so Rachel M said that her fiance sadly was told that he had hepatitis C, casually, like it was nothing. That nurse should have gotten in trouble. She needs sensitivity training. She needs training on how to, give information to patients. You don't do that. That is a life altering information you just gave someone, and you just tell him, like, if you're casually telling him, you know what I mean? Oh, well, your cholesterol is up. Like, that's disgusting. And I'm so sorry, Rachel, that happened to your fiance. Hopefully he is good. Hopefully he got the treatment. And if he didn't, you can talk to me privately and I will help you get the information and the resources to get him treatment. Anyone who may not want to say it publicly, you please reach out to me and I will help you get the resources to get the treatment for hepatitis C. No one should go without the treatment.
Or you could reach out to me,
yes,
and I'll reach out to Cindy.
Now, also about the gentleman that the movie is loosely based on, that is what happened. Way back in the day, people would have lesions, and that was a big indicator that, as soon as people saw lesions, they were like, oh, HIV. They treated you like a leper, basically, like a leper. And it's become different now. You can't be discriminated against from employers because of that, but it still happens. It's the stigma around HIV and AIDS is still huge, just like substance abuse. Legally, people can't, openly discriminate against you for having HIV. Their ass will be sued. But there is still a big stigma, people being unclean. I remember I shared that my sister contracted HIV when my sister was 15 years old. My sister was a kid. And as I've told you, my parents were not educated in substance abuse, in any of that. And I remember the day that my parents were told my sister had HIV. My father, that was the one day I heard my father wailing. And I'm like, what is happening? What is going on? And me and my brothers are like, what's happening? Well, we thought somebody died. Like, that's how much my dad was crying. And when they calmed down, they came and they told me and my brothers what it was with my sister. And I remember, and please, I'm not trying to demonize my stepmother. My stepmother's an amazing woman. She just was ignorant. I remember when my sister would come visit, my sister was given a special fork, a special plate, a special cup. Because my parents didn't know any better. They didn't know. They were terribly afraid. And it made me sad. Like, I didn't understand. I was a kid and I was like, she don't need no damn special fork. But I understand the fear that my parents had. And back in that time, I'm aging myself. I'm an old ass bitch. But there wasn't that much information out there. You know what I mean? And it was thought you could get it just, even if you clean the fork, it was a lot. So there is still a lot of stigma around HIV, sadly. It's not as open. People don't do it as openly as they used to, but I hope I answered your question, because I was like, You know me,
Yeah, no. That you answered it. And for anyone
because I go around the world.
anyone who has not, again, new youngins that have not seen the movie Philadelphia, such a good movie. It is so good.
It
Um,
is.
you know, they had to pay out in a lawsuit because the Beckett's family, Beckett, Bennett, whichever it is, or really you'll see it in the movie, they did go after the person who actually made that movie, and they won an undisclosed amount. I know they were going for like $10 million or something, but it was easily proven that this man, they ripped off his whole life story practically. But it is such a good movie, such a good movie.
Yes.
Okay, so next question. Obviously, the best thing that an addict can do to prevent HIV or Hep C is to seek help to recover. However, if someone is still in active addiction and using intravenously, where can they go for clean needles and free condoms?
There are needle exchanges all over the place. You can go on the internet and Google it. There are needle exchanges everywhere. I know
Okay,
here in New York there are so many. I worked in one. I almost said the name of it. That's all I need, right? Shit. I worked
right.
in one where we would give the little bins, and we would give 10 or 20 clean needles, and we would give them the bins so that they could dispose of the used needles in there. They would return the bins to us. We would give them a new bin with clean works. We would give them the saline solution, because also people, if you don't have the water or the saline solution, people were using the water that was on the side of the curb. I know
Oh,
people, yes, I know people that have
mercy.
used that have used the water on the side of a curb. People have used beer containers that they found the beer inside of there. That's how many people got abscesses, because they didn't.
Toilets, too.
Yes,
Toilets. I remember
yes.
seeing that a few
So it's
times in
important.
movies.
Yes, so it's important. We give the cotton. We give the saline solution. We give the little lids to put the solution in. And I remember we used to have a lot of people protesting that we were encouraging drug use. No, we were not encouraging drug use. We were trying to discourage people leaving needles around where innocent kids could get pricked, where people were just disposing of them in the streets, where people were getting sick. We were trying to help people to stop passing diseases and innocent people. You know, you sit on a bench in a park and there'd be a needle. I remember in New York, you'd go to the beach and there'd be needles in the water. Like, seriously, it was really, really bad. And needle
Mm.
exchanges and harm reduction have helped so much so that people are not just disposing of those needles and all this dangerous stuff, so dangerously, that people, it was just so. There's always that people that say that we're just encouraging people to use drugs. That's not what we're doing. We're trying to teach people to lessen the risks of becoming sick and others becoming infected because people are not disposing of things. We're taking care of that. We're taking the needles and we're disposing of them safely, sanitarily. We're teaching them, we're giving them, the alcohol pads, everything, so that they can lessen the risks. We're just trying. So there's needle exchanges everywhere. You can Google it. You can look on maps in your local area, and they're everywhere. They're everywhere.
Oh,
So yes,
okay. That's good.
yeah,
That's good to know. Definitely good to know because I know my daughter, being a type 1 diabetic, she has to have a sharps container. And did you guys know that syringes are expensive? Good Lord.
yes,
For
yes.
anybody who is a diabetic that's insulin dependent, insane how expensive they are.
They are.
It's somewhat sickening.
They are.
So, they're really, that sort of harm reduction, that had to have brought down numbers in some way, because I'd imagine people don't want to share their needle, they just
Hmm.
don't know where to get one from or clean
Yeah.
one, or
And that's the
you
thing. A
know
lot of people used to share them. I remember you were able to buy them in CVS for $1, but that's expensive, especially if you're using drugs. You are not spending $1 on a clean needle. Like, it was pretty expensive. And it was embarrassing to go into, a CVS and ask for a needle because people were looking at you like, you want one needle, even though they would sell it to you. But you know what I mean?
Yeah.
Just the needle exchanges just made it so
That
much
stigma.
easier. Yes.
Yeah, the stigma again, people
But
are
she's right.
watching
She's right. They do have pharmacies that do needle exchanges as well. So a lot of people have picked up the practice to help out their communities, because that's what we're doing. We're helping our communities. You know what I mean? You don't want people. A lot of people that use drugs will sit in parks, and these are parks where kids are playing. We don't want needles left around where kids are going to be playing. So if you offer these types of services in your local community, you're actually helping your community, because whether you like it or not, these are the practices that are happening in your community. People are going to use drugs. People are going to do these things. And we're trying to help to clean it up and help everyone in that situation. So.
Okay, that makes sense. Where is my other question? Okay, we went over that. So, can HIV, and this is a transmission question again, can HIV, say a person is not using their meds properly,
Right.
and they, have a large amount of whatever the cells are called with that has the HIV in them. Would you T cells?
The
Is that
T
what you called
cells?
it? Something.
Yeah.
Yeah.
The CD4.
If there's a large amount and they're still, they're not doing whatever they should be doing, can obviously a homosexual man to man that is known to give AIDS or HIV, but also a man to a woman. But
Yes.
what about a woman to woman?
Yes, that's we also give dental dams. Sorry, I should have mentioned that. We also give dental dams because, like I said, oral sex, some people may have gingivitis. You may not even see the minuscule bleeding when you brush your teeth. Someone may have nicked themselves from shaving their privates. That is blood to blood. There is a possibility of contracting the virus that way. So we do give out dental dams as well as a barrier between flesh to flesh to avoid any blood to blood, because there is that possibility. There may be nicks that you don't see, little abrasions, and someone may have bled in their gums, and this is all saliva and mucus that is, transmitting. So yeah, it definitely can be done through oral sex. It definitely can. Yes, woman to woman. And the numbers of heterosexual people contracting HIV greatly outweighs any homosexual partners and relationships now. Now the greatest numbers are the younger generation and heterosexual couples. So it's
Why do
definitely
you
changed.
think, besides drug use, why do you think that is? Is it just that young people aren't being educated on HIV as much as we were? I mean, I know, graduating high school in the 90s, I was scared to death. I'm like, oh, hell no. Like, I don't want nobody come near me, because I was very afraid of HIV more than anything.
Yes.
Do you think that is a huge reason, is just the education isn't there anymore?
Yes.
I
I don't know
don't
if you
hear
saw,
about it as often,
I don't
I
know if you
feel.
saw, when I was young, there was the movie Kids. That movie scared the shit out of me. Rosario Dawson was very young and she was in that movie, and it was
Oh, I
called
never
Kids.
seen it.
Oh, you gotta watch it. Oh my God, you
Yeah.
never saw Kids? Ooh.
No, I'm writing it down right now.
It's about young kids in New York and AIDS and everything. And yeah, so there's these two friends. One is promiscuous. Rosario Dawson was very promiscuous, sleeping with a lot of people. There was this one other girl that only slept with one person, And they both, and so Rosario Dawson is like, oh, I'm gonna go get tested for HIV. Will you accompany me? So she goes to get tested, and the friend is just going to keep her company. And they say, well, would you like to get tested too? She's like, I just came to accompany her. She's like, yeah, okay. And Rosario Dawson tests negative, and the friend tests positive. She's only had sex with one person ever, and this other girl who's was promiscuous was negative. And that is so, it was just so honest. And that is happens so much, you know what I mean? People think that you have to sleep with numerous people, and there's people that have one sexual experience and contracted HIV. And I think the problem with kids is they think they're immortal. You know, it can't happen to me,
Yeah.
not me. And if you see a person, like, let's say I'm a parent of just boys, so I always think like a dude. I have 9 brothers. I don't know, I've always thought like a dude. That's weird for me to say, but it's the truth. And so I see my sons, and they see a girl that's beautiful, right? And I always tell my sons, guys, she looks beautiful, but her insides could be towed down from the flow down. Like, don't get it twisted. Like, seriously.
Right.
You know what I
Yeah.
mean? She may look beautiful. She may smell like roses and lavender and all that shit. Shit may be rotten on the inside. You have to be very careful. Don't let that shit fool you. And so I'm always telling my sons that do not be fooled. You do not know what is going on. And sometimes, even like, let's say now with HIV, with other sexually transmitted diseases, like with herpes, with guys, it's maybe more visual. For girls, they may not have anything that's noticeable. It may be internally. They may have warts or lesions internally. So you may not see anything and think that they're good and still catch something. So a lot of kids think they're immortal, and they think that she smells good, she looks good, she can't, so I think that's what it is. Just feeling that they're immortal, they're untouchable, and not being educated and not having an open dialogue at home with your parents. I used to always put condoms in my son's dressers. I don't give a fuck. I'm not in denial. I'm not gonna be like, my sons ain't doing it. No, condoms everywhere. Here. Take them shits. Take them. I would give my sons condoms all the time, because I'd rather them be safe than sorry. You know what I mean? So I think it's important to
Yeah.
educate your kids. Do not assume, no. They wouldn't do that. Yeah. They would. Yes, they would.
Yep.
Teach your kids, because don't expect the schools to do it, because some schools, like I had sex ed in high school, even in Catholic high school, they did teach us sex ed. But I think that it's up to the parents to really be proactive and teach your kids, and teach them that it can happen to them. And I taught my sons that from when I see a little, I hear them talking about girls, I'm like, okay, I got time to put condoms in there. And I did, and I'm grateful that I did. You know what I mean? So
Yeah. And in college, I had to write a paper about HIV. So that's why I did happen to know a little bit more about it. I mean, that was a long time ago. So, I was, like I said, I'm old. I found 2 gray hairs in 2001 and just about died. But regardless,
right.
I did find out that it is this is just basically an FYI for everybody, and I'm sure Cindy knows this as well, but I know this is a definite for sure thing, that say a man is, I guess it could be a woman too, is running around being, all kinds of promiscuous, not telling the woman that he's infected when he knows he's infected, not using condoms, not, no protection, and not saying anything. There have been men that have been given life in prison because they knew about it and they infected multiple people with the virus. So just so you know, and I would imagine that would, hepatitis, you can get it through sex, you said?
Yes.
Or no? Yes, you
can.
Okay.
But
So I'd
it's a
imagine
lot.
it's
It's a
the
lot
same.
less. It's a lot less. It's mainly through, blood to blood. Yeah. So yeah. And
Yeah.
also with hepatitis C, I'm sorry, I wanted to say that and also now HIV, I just learned that hepatitis C, 15 to 20% of people that contract hepatitis C will clear the virus on their own within the first 6 months without any help, any outside help, any treatment, 15 to 20% of people will clear the virus on their own, but they can get it again. You understand? And they may not be. So some 15 to 20% of people will contract acute hepatitis C, and 80% will contract chronic hepatitis C, means the rest of your life. But if you do contract it again after you've cleared it, you may not be so lucky the next time. So you can be reinfected with it. So sorry, again, what were you asking?
When Rachel had mentioned that scenario with her boyfriend, the same exact thing happened to one of my sister's best friends. She had gotten clean and had gotten tested and found out that she was Hep C positive. Her dad ended up, thank goodness, he had some money, because the drug to treat that and cure it, because Hep C is curable now.
Yes, it is.
Was $100,000.
Yes, it is.
100,000, and that was probably 10 years ago. So I don't know. You know, it's probably around 10 years ago.
It was 10 years ago. It was $100,000, and it was Harvoni, right? That was the medication. They have others.
I don't remember.
Yeah,
I don't remember the medication, but $100,000 to cure yourself. You know, imagine getting clean and going through what it takes to recover. You know, detoxing everything, the mental part of it, going through all of that just to find out that you have Hep C. That is for
the
HIV.
treatment took 6 to 8 weeks to go through the whole treatment to then be cured of it. But yes, it was $100,000 10 years ago. You're right. You're right. Sorry.
And from what I understand, a lot of insurances then, I don't know if they do now, but a lot of insurances did not cover it.
No.
So
that's why I had to fight to get that man covered, because he worked hard, and his insurance would not cover it. They would not pay for it. They would not. Yeah.
Wow. Yeah, that's, I mean, nobody should be put in that situation. I think, you know, while it's awful, it's because you're an addict or because you were in sex work or whatever the case may be, no one deserves to die. No one.
Right.
You know, because they can't afford $100,000. Realistically, who could?
Right.
You know, other than if you're really wealthy. But, you know, the average Joes out here, they're not laying out of pocket $100,000. They're just not, you know.
Chanley Dish had asked, dang it, I had it on the screen. Let me see. Hold on. She had asked, if I could find it.
I can pull it up for you. I got it.
You got it? Hi, Misty Go-Go.
Yep.
Hey. Sorry, again.
Is it easier for a female to contract the virus because men enter us? Sorry, graphic, but not sure how to word it. No, it's wording it fine. We're all adults, so
it was believed so. Yes, it has been believed so that it is easier for a woman to contract HIV from a man unless there are extenuating circumstances. A woman is menstruating. She has, let's say, it's rough sex, and let's just say that he is trigger warning graphic. He is digitally penetrating her. Okay, I could say without. Okay, and a fingernail scrapes one of the sides of her internal wall, and she suffers a scratch without him knowing. And then through intercourse, he may contract it that way. But unless there's any of those circumstances, she isn't menstruating, she doesn't have any abrasions to the inside of her, it's easier for a woman to contract it from a man. That's what I was taught. Again, I am not a doctor, guys, because I'm probably going to be dragged after this one too. But
but it makes sense. I've always heard that too. Yeah, I've always heard that too.
This is what I learned in school, guys. Again, I am not a doctor. I'm not a nurse. I am a counselor. So this is to the best of my ability, to the best of my knowledge. Okay. I implore you all to do your own research, please, because I'm tired of being dragged. Okay. Sorry.
You know what,
Damn.
Sydney, I swear to God, like you could walk on water and people will drag you anyway. It's kind of like, you know, I mean, damn, for the little stuff, go ahead and drag away. No one really gives a damn because we're not checking for it. But
leave me alone
yeah,
already. Damn it,
right?
leave me alone.
These sort of things are just, I don't know. Everybody looks to complain. Anyway, so that, I believe, is all of the questions that I had written down. Oh, wait, no. I lied. Does scientists, do they definitively know where AIDS originally came from? I know it was in Africa in like
they say from monkeys,
something.
they say all these. I think it's still up for speculation. Some people say they still, honestly, in my opinion, hold on, let me say that. In my opinion, it's still a lot of speculation, unless some of you guys know more than I do, which I don't think. They were saying it originated from monkeys, it originated from all these places. So I still think it's up for speculation. The real answer, I still think nobody truly, honestly knows.
Yeah, it could be, bats, monkeys, whatever.
Right.
That I've heard all sorts of different things, but monkey was probably the one that I heard the most.
Yes.
And they know that it did originate in Africa. And I think the first case was, if I remember correctly, like in the 30s. Like 1930 something.
Yeah, way before we knew about it, right? Way before we knew what it was. Yes.
And I don't think that they really understood what it was, until obviously much later. But I do think it was very early on that they did learn about HIV as far as people contracting it.
And there are feline HIV, it's so much. But I agree with Stina. She said there's a lot of conspiracies, right? That man made it. It's so many. Like, seriously, I keep my tinfoil hat back there. You guys don't see it. I put it on after I'm done here. But there's a lot of conspiracies. I have some of my own. I don't share publicly because, people laugh at me. But yeah, there's just so much speculation. And I honestly don't think we really genuinely know where it began, where it originated. But yeah. So anybody else have any questions? Sorry, go ahead, JayJay.
Oh, no, I was just going to say, before the medication, there were a lot of people. I mean, and like you said, it really doesn't discriminate, from age to socioeconomic status. Because, I mean, think about it. We lost people like Eazy-E, Freddie Mercury. There were a lot of people who died from HIV.
Yes,
which is
Queen,
absolutely horrible, and they had the money for it.
Yeah, makes me sad. That's interesting what Patty Brunner says. She said, sorry, I have to turn my camera off because I have to come close to read it. In California, you can't donate blood for a year after you get a tattoo. Wow, really? I didn't know that.
Oh my goodness.
I did not know that. Do you know, that's great that you say that, Patty Brunner. Do you know that back in the day, a lot of people contracted hepatitis C and stuff, and HIV through tattoos, not through the actual needles, through the ink wells, because they would use clean needles each time, but they used the same ink, and there was blood in the ink. So they thought they were using new needles every time they tattooed, but it was in the ink itself. So they would have these little ink pots, and they would dip the needle in there, and until they had to. So after a certain amount of time, what they started doing was opening new inks in front of each customer, because the customer wanted to make sure that it was a new ink pot each time, because that was a thing. A lot of people were contracting it through the ink pots. So I think that's great that you mentioned that about tattoos. Jeez. Because that was a thing. Yeah, they were so worried about using clean needles that they never realized that it was actually in the inks themselves. So thank you for bringing that up, because that's a good one.
Yeah.
Jim Jules says, why does everything originate in Africa?
So true.
My boyfriend is in Africa right now in the army. I tell him he is in a lab manufacturing all these things and sending them in shaving cream cans. It's true,
God.
right?
Right, and
Deborah
they say
Young says
everything
Rock
comes from
Hudson too.
Africa.
Yeah.
Oh yes, yeah, Rock Hudson. There were so many, and now I'm like
Yeah.
drawing a blank, but there were a lot. Who's that candelabra guy? What was his name?
I don't know. Don't get me to
Oh,
lie.
I forgot. I forgot who he was. He was like very flamboyant, and I forgot, but I think he died of it as well.
Who am I thinking of? I was thinking of somebody, but then I got distracted with Rock Hudson. Misty says, Cindy, how long do you think maintenance meds should be used? I'm on year 4. I have support, but I'm very conflicted because more addicted to Suboxone than ever before. So in my opinion, it's a very, very personal decision, and I think that this is what I tried to say last time to Sue Elliott. So I'm going to say, make sure that whatever you're feeling, you discuss it with your doctor. You have to know your body, Misty. If you, whatever dose you're on, if it's holding you and you're ready to try to come down a few milligrams and you're comfortable with that, I would try it. I would try, in my opinion. Oh my God, man. Let me say that. Okay, this is what I would do. Let me just say what I would do if I were you. I would, if I'm comfortable, right, on the dose, I would try to come down a few and see how I feel there. And if I'm comfortable there, if it's holding me, if I'm not feeling withdrawals, because that is the most important thing. You want to listen to your body. You don't want to rush it and then end up going into withdrawals, right? Because we all know withdrawals are physical, but it also is mentally draining. So it's not only a mental thing with withdrawals, it's a physical thing. It manifests itself in our bodies. It controls our mood. It makes us depressed. It makes us feel lethargic. Nothing is entertaining. Everything is boring. So it's really, really about being honest with yourself and knowing if it's too soon for you. Please don't rush because you feel that someone else, or to live up to anyone else's expectations, because you may read that certain amount of people get off by this certain time. It's very individual, and it's about the long-term goal, right? This is not a sprint. This is a marathon. Okay, so if you think about it like that, it's not a sprint, right? You don't want to rush to get to the finish line. It's about taking your time and crossing the finish line instead of trying to run and ending up tripping and never making it across that threshold. So I would do it at your own pace, and always talk to your doctor, whoever oversees your dosage, and talk to him and let them know how you're feeling, if it's holding you. That's what I would do. It's very important to have an open dialogue with your doctor, whoever's overseeing it, and to be honest with yourself. Please do not feel like you have to do something at a certain time because of the stigma or because of, what other people think we should be doing. Fuck that. Okay? Fuck everybody. Seriously. It's about you, and be proud that you are no longer living and suffering and struggling with your addiction. You're on maintenance medication that is helping you to live, not exist. Because I know in my addiction, I was existing, I wasn't living. So now you're not existing anymore, Misty. You're living, you're thriving. Look at all the positives you have. Okay? I hope I answered that for you. And I heard the baby, she tired? She tired? Oh, she's so tired.
She's actually sleeping right next to me, and
Oh,
she
my
just
God.
moves her little self and moans, and then falls asleep, and then moves her little self and moans. She's the cutest little thing.
Yeah.
I love her.
Yeah. She's so cute. She's so cute. The Amber Chick says there's a big difference in being addicted versus being dependent on a medication. We don't stigmatize blood pressure medication. Why do we stigmatize Suboxone? It's ignorant, in my honest opinion, and I agree. I
Yeah,
agree. No
definitely.
one should be forced to have a set time limit because somebody else is trying to dictate someone else's recovery. No, no.
Cindy, you're rocking
Yes.
back and forth. You better be
Oh,
careful with that
oh.
shit. You know what's
Oh
gonna
yeah,
happen.
I know. And if I'm nodding along to what you say, let me chill. Yeah, I'm good, guys. But yeah, I think that it's true. We stigmatize people when that is a medication, like you've said. It's a medication that's helping. It's changed the quality of people's lives. People on maintenance medication are able to work, are able to thrive. So
Right.
I
Yeah.
agree. I agree. We have to, this is why we're here, to try to end the stigma. If not end the stigma, maybe teach some who can teach someone else. You pass it along, right? You learn something new about somebody that's in recovery or was an addict, and you pass it along, and that is how education is gotten, and that's how ignorance is beaten, in my opinion.
Yeah.
So yeah, yeah. So I agree. Kimberly, hi Kimberly Roddy, I missed you, Mama. How are you? So happy to see you here, my girl, my unicorn queen. I remember when HIV and AIDS were so taboo. I think that show Real World showed me what it really looks like. Yes, it was, right. I remember that too. I'm telling you, when my sister first got it, my dad's whole world was shattered because she was a baby. She was 15 years old. You know what I mean? Like, that was my dad's first child. My dad loved he loves his children. He loved my sister. Of course, it was his daughter. And he was destroyed. I'm telling you, I've never heard my father cry like that, and I've never heard him cry like that again. The sound that my father made is a sound I would never want to hear a parent make. And I thought someone had died. And I guess, in a sense, to my dad, it was sort of a death. And when my sister passed, my dad took it so hard. My dad took it so hard. And this is why I became educated, guys, because it affected me, because it affected my sister. My sister was my best friend in the whole world. My sister was my life. She was the best sister. She was everything. And and I miss her. And I miss her. So I wanted to become educated to maybe help others with HIV and help others with substance abuse. I remember when I was young, I was like 18 years old. My sister would be out in the Bronx, and I didn't know anything about the Bronx back then. And I would go looking for my sister. I didn't even know where to look. Somebody would just tell me, "Oh, I think your sister was seen around 183rd Street," and I didn't realize how big the Bronx is, and I would just go to 183rd Street and swear I was going to find my sister, and it was devastating. It was devastating, and I wouldn't wish that on anyone. And so that's why I really educated myself about HIV, and I wanted to help my sister. And it broke my heart that I was working, teaching people harm reduction, counseling people with HIV. And I would tell my sister, "Are you taking your medication, sis? Are you taking your medication?" And she refused to take the medication because the side effects. At that time, my sister was on a cocktail, which was a lot more pills. Like I said, my sister died 7 years ago, um, before they had combined all the pills into. So it was a lot of pills she had to take, and the side effects were so bad to her that she didn't want to take it, and I couldn't force her. She's grown. I couldn't, you know what I mean? I couldn't force feed the medication, and my sister would sell her medication because people would send it to the Dominican Republic, and they would pay a lot of money for those medications. So my sister would sell her medication because she wasn't taking it. And that was like the hardest thing. You educate yourself, you go to school to help people with HIV, and the person that you love the most, you can't help. That broke my heart. I couldn't help my sister. And so when I come here and I talk about substance abuse and I talk about HIV, and I'm trying to educate the best way I can, it's because it's touched me personally, and it doesn't. I just, if I can help one person the way I couldn't help my sister, that's all I want to do here. And I know I've been in drama. I know I've put myself in some stuff, and I'm sorry. And I'm sorry about that. I don't want to be in any. I don't want to be in any more drama, guys. I don't want to deal with it. I just seriously, it's 2022 and I'm done. And
Yeah.
so for any parts that I've played in all of that, I'm sorry. I'm sorry. I don't want to do that anymore. Okay?
No,
So
neither do I.
I can't change the past, what I've done, but I'm sincerely over it and I'm not going to take part in it anymore. I'm going to come here and try to have fun with you guys and hopefully entertain you guys while educating and we can educate each other, but I don't want to do it anymore, guys. I don't want to fight with anyone anymore. I don't. Okay? And I know I've taken part in it and I'm here to apologize to anybody that I've, you know, been a bitch to. I'm sorry. Okay? From this day forward, I'm not doing it anymore. You can say whatever you want. You can think whatever you want about me. I'm tired. It's too draining. And this is not why I came here. This is not why I made my channel. And I kind of lost sight of that, but I'm back on track. So I'm not doing that anymore. And JayJay, we're not doing that shit anymore. We're not doing it.
No, no, it is very draining. Very, you see things said about you or a close friend, and right away you want to react, and when it's lies said about you, it's hard. It's really hard to watch that stuff said when you are not the person that you're made out to be, or your friend is not a certain way that she's portrayed to be, and it it's difficult. It is. So yeah, I just don't really want anything to do with it anymore.
And we're going to try to be better for 2022. We're not going to just say we don't want to do it. Our actions are going to show that. So this is what we're doing. We're coming here. We're having streams that don't focus on none of that, because at the end of the day, that shit doesn't matter. It doesn't matter. I don't want to come here and hurt somebody's heart and mess up somebody's day or somebody's evening. That's not what I want to do. I want to come in. Hopefully, when you guys leave, you'll have a good feeling in your heart, having been with us, having hung out with us, see how silly we are. That's what I want. So I really, and I'm thankful for all you guys that come here and spend time with us. And that's all I want. And I'm grateful for that. And I thank you guys. JayJay, anything else you want to say before we say goodbye for today?
No, I think that's it. My little miss here is getting a little cranky, so I got to
Yeah,
get off
yeah.
anyway. But yeah, it's good to see all of you, and thank you, Cindy, for having me out.
Anytime, JayJay, like, she good. This is our channel. This is me and JayJay's channel. But during the week, we will hopefully, me and JayJay will have our live. I gotta get to her channel a little more. But again, thank you guys for being here again. We tried to educate the best we can. Please do your own research. You know what I mean? I I tried the best I can to inform as much as I can. Um, I love you guys. We love you guys. We thank you for being here. Seriously, seriously, thank you guys. You guys, all the support. I'm overwhelmed by it. Seriously, and I'm humbled. And JayJay, I love you, my manita, always, always, para siempre. And to everybody here, thank you for being here again. Te quiero, te adoro. Love you. Hasta luego. Bye, guys. Love you guys. I don't know. I don't want to do that stupid outro. That shit is corny. But listen, Linda. Until I get a new outro, we're gonna have to deal with that corny ass outro. You understand? Oh, damn it! Sorry. Bye, guys. Love you.